we're going to be moving on to our joint assessment. So we're assessing for hypermobility of the TMJ on each side, and then we're also assessing for symptom reproduction while we're doing this glide. So 2 glides that we're going to be doing intraorally are our distraction glide. So I'm going to be trying to distract or pull apart, I guess, open up this TMJ, move the condyle away from the skull. The other one that we're going to do intraorally is a lateral glide, and I'll show you on the skull in a minute where my hands are going to be. So for a distraction glide in assessment, I want to be palpating with one hand that joint line so I can assess what is happening at that joint. So just open and close your mouth, good, and then relax. So I'm sure that my fingers are right over that joint line near the condyle. My other one for a distraction glide, I'm going to run my thumb along the teeth, so move to the back, make sure you stay on the teeth and that your finger's not inside there, because a lot of people are kind of sensitive towards that back of the tongue and throat area. So thumb stays on the teeth, and then I'm just going to be trying to pull that back of the teeth away from this finger. So I'm kind of pulling it towards his feet. So just open your mouth, good, and then just relax, good. On the outside, I'm using my fingers on the outside to get a good hook around that mandible, so I'm really able to get a good control over that bone that I'm trying to move. This hand is just palpating. So Jack, I'm just going to be pulling down on your teeth. Let me know if you get any pain or discomfort. It should be pretty comfortable. Just relax your mouth, good. And then I'm just going to be pulling, so the pressure is all through the back or the top of my thumb, and I'm trying to pull that back of the mandible down towards his feet. The biggest mistake that people make with distraction is that you're pulling with the base of your thumb, like at the front of the mouth. What you'll see if you do that is that you're just doing P-ROM of mouth opening. So and then just relax. If I'm pulling with the front, I'm just going to be opening his mouth. We're wanting a distraction. So you need to be pulling with the tip of your thumb down, and then you're going to be feeling at this finger a little bit of gapping or opening up around that joint line. The next one that we're going to do intraorally is a lateral glide. So in this position, I'm going to be standing on the opposite side of the bed, palpating that joint line again, and then I'm going to be getting on the medial aspect of the mandible. So if I'm doing a lateral glide, I need to be, it's a lateral glide of this joint, but it's actually doing a medial glide of this joint, okay? And we'll look at this in a bit more detail in treatment. So just open your mouth, good, and then relax. So my thumb is again hooked, my thumb is on the medial aspect of the mandible, my fingers are hooked around the jaw, and then I'm just trying to pull that jaw laterally, so towards this way, okay? And again, I'm assessing any movement, so hypo versus hyper compared to the other side, and any symptom reproduction that he might be reporting. Okay, so just so you can see where and appreciate where my fingers were inside the mouth with those joint glides and what we're trying to achieve at the TMJ, I'm just going to demonstrate on this skeleton to hopefully make that make a little bit more sense. So on the outside, my hand is palpating this TMJ joint line, okay? With the moving hand, for a distraction glide, I want my thumbs on top of the molars, so it's between their teeth. My hand is going to wrap around that mandible, so I'll just hold down here just so you can see a bit better, but in reality, I'm gripping onto that mandible around there. What I'm going to do with the distraction glide is I'm trying to bring this bone away from the skull, okay? So under my finger, I should feel a gapping happen with that. You'll notice if I, relocate that jaw, if I was doing more through the front of my hand, first of all, you'll notice the mouth is opening. Second of all, you'll notice that there's no distraction movement happening here. So it's really important that we're trying to pull from the back of the teeth. For a lateral glide, I'm going to come onto the medial aspect of the mandible and grip around that mandible again, palpating the joint line. So for this one, I'm trying to move this left TMJ or this mandible to the left for a left lateral glide of the TMJ. It's also important to appreciate that when I'm doing this, it's also doing a medial glide on the right TMJ. So just make sure when you're talking to your patient and getting an idea of what they're feeling during it, clarify which side they're feeling it on, because sometimes they'll feel it on the other side. The last thing that we're going to be doing as part of our jaw assessment in the objective examination is going to be doing a PA glide. So this completes our jaw joint assessment. So we do this extraorally. You can find that TMJ, so I'm palpating this side, but again, important to remember that it is having an effect on the bottom side as well. Jack, can I get you to get your bottom hand and just rest it under your face, please? The bottom hand, yeah. Cool, so often that is nice and comfortable to the patient, just helps to give that bottom TMJ a little bit of support as well. So a PA movement, arthrokinematically, is linked up with the translation component that they get during opening. So for this, I'm going to be palpating the joint line with this hand. And Jack, if you just open them out, yeah, good, and then close. So I'm just double checking that I'm over that joint line. This is a really tender spot, remember, at the back of the jaw joint. So we just need to make sure that our thumb is kind of on bone as much as possible instead of just pushing soft tissue in the back onto the back of the mandible. That'll be really uncomfortable for the patient. We're also not needing a great degree of pressure with this one. So we're just trying to assess any of that PA movement that's happening at that TMJ. So Jack, with this one, I'm just going to be having a feel of what's happening at the joint. I'm just going to be gently pushing forward with this hand onto the back of your jaw, and I just want you to let me know if you're getting any pain or discomfort as I'm doing this, okay? And at this joint, I'm feeling that condyle move forward as I push. I find making like a little gun shape is helpful just because my index finger is pointing where I want that jaw to go. So for a true PA movement, I'm going to be pushing towards his lips, okay? You can assess these in varying degrees of jaw opening. So if I wanted to get him to open his mouth a little bit, I might just be adjusting what position or what angle I'm pushing that jaw in slightly. But in a closed mouth position for a true PA, I'm going to just be pushing directly forward.